I think we need to move forward in the interest of time. Dr. Azad and Dr. Domenico are joining us shortly, so I'll invite co-chair Dr. Vici Wu, a great friend and a prolific ROP specialist.
Coagulation remain the standard treatment for ROP. It acts by destroying the peripheral vascular retina and reduce the VEGF production. And on the other hand, intravitreal anti-VEGF like bevacizumab, we work directly neutralize the VEGF in the vitreous. So because it did not destroy the retina, so it has better preservation of the retina. So each treatment has their advantage and drawbacks. One of the main drawbacks of the anti-VEGF use is that its association with potential neurodevelopmental impairments. Why? Because all of the intravitreal injection of anti-VEGF drug, they would lead to systemic circulation. In our prior study, we found out that if you inject bevacizumab or Privacid, the systemic VEGF suppression was up to 12 weeks, almost 3 months. And because VEGF is such an important neurodevelopmental growth factor, so people would worry that in this vulnerable group of patients, whether their long-term neurodevelopmental outcome will be affected after such treatments. So we don't know their long-term outcome yet. So since 2016, we have been tracking our patient with prior treatment of the anti-VEGF, and we prospectively track those patients, and we use different neurodevelopmental tools to access their neurodevelopmental outcome appropriate to their age. So since 2016, 2019, 2021, and 2023, we have tracked their outcome, and we do not find significant differences in the individual treated with anti-VEGF versus their comparable control groups. Then recently, we did another study. We tracked the patients even further up to the age of 8. Why do we need to do this study? Because actually, our brain acquire 90% of brain volume after the age of 6. And some neurodevelopmental defect will not appear even before the age of 5. So if you do the neural assessment before 5, you could miss those problems. So we did a prospective study and enrolled 277 patients at our center. We have 4 groups of patients. Group 1 is full term, Group 2 is preterm, and Group 3 is ROP without treatment. Group 4 were ROP with laser or bevacizumab or both treatments. And the main outcome measure were the full-scale intelligence quotient, FIQ score, calculated by Wechsler intelligence scale for children, 4th edition, WISC-4. So WISC-4 is a cognitive assessment test appropriate for children aged 6 to 16 years old. It consists of 15 domains, evaluating verbal comprehension, perceptual reasoning, working memory, processing speed, and fluid reasoning. It has a mean score of 100 with standard deviation of 15, and in the prior research, it showed great consistency. So this is one of the examples of the test. You ask the children to read this number either forward or backward fashions and see how they perform. And here were the statistical analysis we did in these studies. Here were the results. So among the, compared to the full-term and preterm without ROP, ROP group definitely have a lower GA, gestation age, and lower birth weight. And also compared to the full-term and the preterm without ROP, the ROP group have significantly worse vision. And here's the FIQ score, the full score and the percentile. Also, again, you compare to the full-term and preterm without ROP, the ROP group show lower score. Okay, so patient with ROP show significantly low FIQ score and percentile when compared to full-term and preterm without ROP. Then we just look at the ROP group, either without and with treatments. And, but then we look at their vision. We did not see significant differences in their visions. And then we look at their FIQ score. This is probably the most important slide. And basically, we didn't find significant differences in their full score and their percentile. So you could see that the individual treated with laser or Avastin or combination has similar score. But you do see slightly lower score in the combined group. And then we did the linear regression model, and only two factors come out. One is low gestation age and lower vision were associated with lower score of the neurodevelopment. And in the percentile, similar findings were noted. Only GA, low GA, and poor vision were associated with the FIQ score. So basically, we did not find a normal neurodevelopmental outcome in patients with prior bevacizumab treatment compared to laser. But however, in the past, there are studies like this one performed by Dr. Maurice group from Canada. They do show that there were 3-4 increase in severe neurodevelopmental disability in patients receiving bevacizumab compared to treated with laser. However, there are a couple issues in this study. First is selection bias, because sicker infants were more in the bevacizumab group, and 11 infants in the mild disease was noted in the laser group. That means they do not meet the criteria of type 1 ROP and got treated. And there was imbalance in missing data as well. Bailey 3 assessment could not be performed for 9 infants in the laser group, but only 1 in the bevacizumab group. And for those babies, it's very likely they could have certain form of neurodevelopmental issues. Also, the loss to follow-up percentage was 28%. That could significantly skew the final outcomes. So recently, there are clinical trial data showing up, like Firefly Next, and as well as Rainbow Extension study. They don't see any significant neurodevelopmental issue in the eye treated with anti-VEGF. So the take-home message here is that we did not find significant differences in the FIQ score and percentile in the individual treated with bevacizumab compared to laser, and only lower gestation age and poor vision could correlate with a lower score. This paper was recently accepted in the Journal of Retina. If you are interested, you could reference this. And thanks so much for your attention. Thank you.
Thank you, Professor Vici. That's you've been doing a lot of work on the long-term outcomes of anti-VEGF, and you've demonstrated that in this recent publication as well. There has been a neurodevelopmental meta-analysis about 3 decades that came out of a few neonatologists in Europe, India, and Australia, where they looked at primarily the chances of cerebral palsy and autism in babies who were treated with anti-VEGF versus laser. And they found that although it was not statistically significant, there was a clinically higher significance of NDI. And then they found that those who had a second injection possibly had a higher chance of that, and those who had combined therapy, the chances of further worsening of NDI had reduced. Do you have any thoughts on the second injection versus protection with laser combined with the first anti-VEGF?
Yeah, I think that's a great point. That's also a big concern for us. So that's the reason why in the past, I only performed the anti-VEGF injection once for over 99% of my patients, if they do not respond to the therapy, I switch to laser because you see that single injection result in suppression of systemic VEGF up to 3 months. So if you have a second injection, it could be 5 months or even longer, I don't know. So that's a big issue. But right now, because this treatment has been in practice for over a decade, so we have more and more long-term data coming out. So we should keep on surveying these data, and if there are signals showing that it could be potentially damaging the infant's development, we should let everyone know.
Thank you so much.
Thank you.